Thanks for joining me, Dr. Didyk.
Oh, it's my pleasure. Yeah, thanks for asking.
Congratulations on your nomination for Rogers Woman of the Year in the Health and Wellness category.
Thank you. Yeah, what an esteemed group of ladies that were nominated. It was really fun.
Yeah. You were in amazing company. And in particular, I really got to know more about the geriatrics work that you do in this region. And in particularly with the geriatric medically complex clinic. Can you tell us more about what you did at this clinic prior to the pandemic?
Sure. Well, so, like the name says, it's called Geriatric Medically Complex Clinic. So we look after older adults, and we don't, a lot of people think of a geriatric clinic as a place where, you can maybe learn how to stop aging, or, if you're like sort of a healthy older adult, but we really see people who are living with complexity. So a lot of times people have more than one chronic condition. So they might be living with arthritis, but also have some Alzheimer's. And then on top of that, they might have some social stressors. So for example, their partner might be ill, or they might have an adult child who's living at home who's also, got some health or other issues. So those are the kind of people that we would see there. And usually they would be referred to our clinic if they've had a fall, or if they've been in hospital and had an episode of delirium or something like that. And so we take a very thorough and lengthy kind of approach to look at the person from head to toe, look at all their medications, look at all their other conditions, and try to come up with a plan that is person-centered. So we try to find out all this information, but then we go back to what's the goal of the older adult and how can we help? So we have geriatricians and also nurse practitioners, and then we work really closely with our partners in the community. So home care, for example, a lot of the in the community, there are a lot of day programs and recreation programs for seniors, which we rely on pretty heavily.
Right.
And that's one thing we should talk about today, is how when those programs are closed or on hold because of COVID, what happens to those complex older adults.
Most definitely, yes. That will be our focus today. Now, I noticed that you're using the term older adult, and I know I'm used to using the term seniors. And as a medical professional, you're saying older adult. Why are you using that terminology?
Well, I mean, language is changing all the time, right? And so older people, they're no exception to how we're looking at language. And senior, I mean, it can have a nice connotation, right? It's your kind of that you've been around a bit longer, you've maybe got more privileges than the junior person would. But I think because it's been associated with a lot of negative things over time, that word is a little bit outmoded and a little bit outdated now. And it's been adapted into terms like senior moment, for example, or get that senior discount, So I think older adult is just more descriptive, right? It just means that the person has lived longer, they're further along in their life cycle. And so that's a term that we're using now. So, I mean, I don't think saying senior isn't a bad word, but we're moving away from it slowly.
I see the evolution, and I think, as you say, that it's become, because unfortunately people are using it in a derogatory sense, and I'm sure it's self-deprecation maybe, but it's turned into something else. So I could see why, and people, older adults will give people dignity and respect that they deserve. Absolutely. So going back to the clinic, so this was held. The one that you worked at was at St. Mary's Hospital, and you were meeting face to face. I think you were chatting earlier, and you said you were meeting 5 days a week?
Yes. Yeah. We had the clinic running 5 days a week, and I wasn't there every day, but there was, a geriatrician and a nurse practitioner. And we did have face-to-face visits, and we met with patients and their families. And that's the thing too, is it's usually not just one-to-one. There's usually at least one family member, and sometimes more. So sometimes there's a partner and a child, or two children. So that was how it worked. And it was a long assessment, and we did have to kind of get up close to do a physical exam and that. But that all stopped in March of 2020.
Exactly. Tell us more. How
Yeah.
did you have to, I know people like to say pivot, and people say
Yeah,
they
we
don't, they're
pivoted.
tired of the word pivot. How did you have to adjust? How did your clinic have to change to meet the needs of your older
Yeah.
adults?
Well, it was quite a pivot and we felt like we were spinning for a while, but we moved to a virtual platform. So we were so thankful that we had support from some of our community partners. So the Canadian Mental Health Association of Waterloo, Wellington actually was able to provide some support. St. Mary's continued to provide support as well, but just on a different sort of platform. And then we moved into a virtual model, and which is still going actually. And so we would have visits over the phone as well as over video. So kind of like this type of platform with you and I, there's one called Ontario Telemedicine Network, which is secure and was sort of designed for medical encounters. So as long as we have a patient's email, we can invite them to the visit. So there's pros and cons with that model. And we continue to do home visits for those that we really couldn't do virtually. Because there were some cases where unfortunately, we couldn't do it virtually. So that was kind of another option, but most of the time we were able to do virtual care, and it's been a real learning experience.
Oh, it has been for all of us, I'm sure. Now, when or a year has gone by, what trends were you seeing for seniors that, maybe you weren't expecting, things that happened as a result of the lockdown?
Yeah, well, and I think a lot of people, it's so funny, to reflect now, because when it started, I remember having discussions that we were going to keep in this model till maybe we would start in March, we would go till June, and then maybe it was like, well, maybe in September, we'll go back to something more normal, or maybe in January. But so now here we are, and things haven't changed that much. I think at the beginning, we saw a lot of people just putting things off. So they would say, oh, we don't need an appointment. We'll wait until we can see you face to face. And then after 6 months, they would call back and say, you know what, let's have an appointment. And I would see a lot of the consequences of having deferred that visit. And I think people were deferring medical visits, but a lot of other things too. And I have to say that a common theme was just that contraction of the person's world and their social sphere shrinking down. Along with that, the physical activity shrinking down. And there's some evidence to show that that's happened as well. So especially out of Europe, there've been a lot of surveys in Spain and Italy and in China also. And it has been shown that physical activity has markedly gone down in older adults. So that's really something I'm seeing, is that a lot of people have kind of spent a lot of couch time. And we know, even in a younger person, that can make you feel weak and tired, and and it can make you weak. It can make your muscles weaken.
Right.
But in
right.
older people, that happens so much in such a more pronounced way that it can be a lot harder to reverse.
And so were you making more diagnosis for, when you say weakness, what would that result in?
Yeah. Well, the medical term that we use is deconditioning.
Okay.
So it's kind of like the opposite of, you can think about if you want to build up your muscles, or if you're training for a marathon or something, right? You're kind of conditioning yourself. So deconditioning is that process in reverse. But in older people, it's not, it shows up in a more mysterious way. So we might see that people are more likely to fall, because now it's harder to have the strength to get up out of a chair, and to have the balance as well to get up out of the chair. Or somebody might now need a walker or a cane, but they haven't been able to kind of get organized to get that. So they're more likely to fall. They're more likely to have this apathy kind of syndrome, which is just not wanting to do things, not having drive or motivation. So even I remember one family telling me, yeah, we used to play boggle, every day. And now I can barely get them to play one round. And we used to play for hours, and then we would do something else. Now it's like one round and he goes back to bed. So really seeing that more sleeping, more falls, and depression too, because social isolation and the reduced physical activity, all of those things can contribute to a lower mood.
Right. And one thing I thought of where like I used to work in downtown. Well, I still work, but because of the
Right.
pandemic, I'm working from home. But when I
Yeah.
worked in an office in downtown Kitchener, you'd go to coffee culture and, you'd have the corner there every day, or not every day for me, but I would see
Yeah.
there was the usuals or a Tim Hortons that they would be sitting down having a coffee. There would be this
Yeah.
social network, the older adults, and that they'd get together, and that was their thing.
Yeah.
And because of the restrictions, it can't be their thing anymore.
I know. It's true. Like a lot of people had these informal day programs at Tim Hortons, the mall, McDonald's, right, with their bottomless senior coffee. And also think about faith communities, right? So with their activities being limited, all of the church suppers and all of the parties and all of the gatherings that would have happened. So yeah, all of those things were had a therapeutic angle for older people. And so those have been closed for a long time. Not to mention people living in retirement homes or other places where there's a lot of older adults kind of living together. The dining room has been closed, or it's been, one person per table kind of thing. So, and there definitely have been times when long-term care homes or retirement homes have been in lockdown, and people have just been eating in their rooms. So yeah, but you're right. Those informal day programs were really, really, really important.
Right. And now because people don't have that, you're seeing the increase in the apathy and depression, as you said. Are you seeing a ripple effect for caregivers as well?
Oh, absolutely. Yeah, absolutely. And I think because a lot of those day programs too are what we would call a respite for the care partner, right? So, and that's another terminology thing is caregiver is sometimes people are using care partner interchangeably, just because it's not all giving, right? There's some receiving too. So, so if you hear me say care partner, that's why. But yeah, like a lot of times, if you're caring for someone who's living with a disability, like dementia, for example, knowing that they can go to the day program for 6 hours a week, you would kind of know you had that chunk of time to do the things that you have to do for your health. And so if that changes, you don't get that respite. If the person who's living with dementia has less drive, they might become more dependent. They might have more disability. So they might not, it might not be as easy for that person to participate in the things they do day to day, like dressing and bathing and helping with the cooking or what have you, So, so yeah, care partners are really feeling that additional strain. And they also maybe don't have the outlets that they would have, like going to the gym or meeting up with friends, or even having family members that could come in to help, right? I've heard a lot of people say that, well, my daughter used to come, but now she can't because she's a healthcare worker and she doesn't want to make us sick or something like that. So
yes,
that's a really good point.
It's better safe than sorry. Yeah, and there's always that other side of the coin. You want to be careful, but there is a cost to it. So all these, it's all these challenges that we're hearing about, but there is hope. You're a doctor, and you're about making people better. So what actions can older adults take for their well-being, even given provincial restrictions?
Well, I'm glad you asked, because it's really the other thing that we should emphasize too is that we're talking about the negative aspects, but older adults are incredibly resilient. And that's one thing I like about the Waterloo Wellington older adult strategy. They've got a campaign called Leading the Way. And a lot of your viewers have probably seen it in the paper and on TV, but that kind of emphasizes that older adults have really risen to the challenge. And so I find that a lot of older adults who aren't living with disability, they've continued to volunteer. They've continued to check in on each other. They have formed networks, virtual networks. Older adults have learned how to use technology to make the connections that they need to make. They've reached out for help when they need it. So all of that is really good. And I found that older people have been a real example and a real beacon during this time. And they've also been very good about adhering to public health guidelines, right? Like I find that
that
when
generation,
when I see older adults walking, they will keep a distance, they will, they'll wear masks if they're, if they're more comfortable doing that, or if they're not feeling well. So I find that that's really, really neat. So there's a lot positive going on. But if people want to take it to the next level, I think what I would say the most important thing is probably intentional physical activity. And you can do that at home. You don't necessarily need special equipment. And especially now that the weather's a little nicer, it could be, walking or gardening, or, we just anything like that, lifting things, carrying things around your house. But it could be, so what if people want a guideline, it's 150 to 300 minutes per week of fairly moderate to vigorous exercise. And so moderate means that you could talk, but you can't sing. So if you're walking along with someone, you could carry on a conversation, but if you had to, it was Broadway and you had to bust out into a solo, that would be hard. So that means you're working moderately. And if it's vigorous, then you're probably sweating a bit, and you're probably, you probably would find it difficult to carry on a conversation. So get up to that level of activity and do it 5 to 7 days a week, so you can take a couple of days off, but try to do a little bit every day. And then bring in some strength training. So that doesn't mean you have to lift barbells, but you can step up and down, you can sit up and down. So you can practice getting out of your chair without using your arms. You can do some squats. And I like to take a big exercise ball and kind of roll up and down against the wall, because that seems to spare my knees a little bit.
Okay.
So do that.
And I guess whatever level of physical fitness you have,
absolutely,
you don't do it till it hurts, right?
You do not know if you're feeling pain. That's not what you should be feeling. So no, there shouldn't be pain to get the gain. But even just dancing to music, like put on some music and just move your body, and you'll be surprised when you start sweating. That's a good example. And the strength training too, it could be walking on your toes, and that's a good balance exercise too, or walking on your heels. All of those little things. I find my phone, I don't seem to get good cell phone coverage. And so I have to walk around my house to find a good spot. And then it seems like every place that I could sit or recline, I don't get good coverage. So I have to keep, it's like someone's doing this to me on purpose. I have to stand somewhere and sort of pace around to get good coverage.
That's funny.
But it's good, right? So that means when I'm in a conversation, I'm going to be moving. And all of those things will help your body. It helps blood flow. It even releases positive chemicals. If we could look at your brain when you're moving vigorously, we would see these brain-derived neurotrophic factor, and that more active in that hippocampus, that part of the brain that helps with memory and all of that.
Fireworks for your brain. Nice.
Yes.
In terms for mental health, so what tips would you have for keeping positive mental health during isolation? It's really difficult.
It is hard. Yeah. And I must say that I've experienced that too. And, I think everyone can relate. And a lot of your viewers have heard this, but it is true. It's important. So physical activity will help your mood, but sleep, don't forget about sleep. So try to have a normal bedtime, normal wake up time. So for me, that has kind of shifted an hour or so, but it's still regular. So it's not like, I might go to bed an hour later and get up an hour later, but I'm not getting more sleep. So do pay attention to that. And then make those electronic connections. Like you may not have the internet, or you may not have a tablet or something, but the phone works really well. And there are lots of, I will share with you, ways if you've exhausted your address book and you've called all your friends, well, there are places to reach out if you need to hear a friendly voice. But doing that reach out, using those telecommunications tools, it is still contact. right? Anandi, we're still connecting and having a little visit. And so
Yes,
it's
yes.
something.
It is.
Yeah.
It is something, and we have to do something to keep on top of it.
Mhm.
And just as an aside, I don't know if this part will stay in the interview,
Sure.
but I can definitely relate to the timing shifting. Like before, I'd have to get up early, make sure I had my breakfast, pack my lunch, got downtown, parked. And now I get up, get dressed, most days have a shower. That's the part that I don't want on air.
Oh, come on.
Yeah. And yeah, my commute is like 6 steps to the next room. I'm really lucky that I have an extra room I can designate as my office. And the commute is, I don't know, like 10 seconds now. That's amazing.
Isn't it
and
weird?
No more carpooling. No more carpooling. Nicole.
Those good old days.
Yes, the good old days.
No, it is. And there's kind of cool things about that, eh? You can eat lunch at home every day.
Yes.
You can go out to your garden and, see what's happening there when you're taking a break.
Yeah,
but
walks in the middle of the day. It's so easy now.
Yeah. So there is a lot of positive, and I hope some of those things will carry on. I hope that we will have some virtual care, because a lot of people find it better and easier sometimes. So yeah, I think we've learned a lot, and some hard lessons, but some really interesting and happy discoveries. And I think too, the other tip is to be careful about how much media you take in, and in term, not wonderful positive shows like this, but the news, and there've been entire weeks where I don't really watch the news. I kind of figure that if something major happens, my mom will tell me about it, but sometimes I want to go to a few trusted outlets, that I know will kind of give me the facts, and then keep it to that 30 minutes to an hour a day. And then, focus on what's happening in my world. I think that is important. It's not that we don't want to know about things, but I think that that we can really get caught up in the negative and the fear, and that's not helpful for our mental health. So it's good to be informed, but keep it in small bites, and then, hang out with your pets or your house plants or whatever brings you that peace and calm to balance it out.
So true. Thank you, Nicole. And just my last question here. You have a great resource. You have a great online resource for older adults. So I thought this would be something that people can have in their back pocket for future use. So can you tell us more about your online resource?
Yes. You know what? I can't believe it hasn't come up already, but yeah, all of the stuff I'm talking about. I love this technology communication and putting things on video and that, and the internet, I think, can be a great place to get medical information. So a couple of years ago, I set up a website called thewrinkle.ca. And this is the place where I have some articles, a lot of videos, and other things where you can learn more about how to age well, or how to help another person to age well. And I strongly believe in getting information from a credible source, and then being able to have some dialogue too. So at thewrinkle.ca, and also my my YouTube channel of the same name, you can leave comments and ask me to do a video on a certain topic, or write an article, or even just ask a question. We can't give medical advice, but I can sort of point people towards the right medical education, which is what I love to do.
Oh, thank you for sharing. So thank you so much for joining me today. And also, I just a special thank you. Like I see the signs in the neighborhood. Our heroes wear scrubs, and that's what I think of you, Dr. Didyk. It's amazing that you just get out there every day and you're helping people, and you're doing your best to keep them well. Thank you for your service.
Thank you. That means the world to me. It really does.